Hi, and welcome back to Foundations in Direct Assessment of Academic Behavior. In this video, part 3, we're going to compare behavioral and non-behavioral, that is traditional approaches to academic assessment in terms of their assumptions about learning and behavior, their implications, how data are used, and various other characteristics. So let's first begin with assumptions. Okay, we're going to start on the behavioral side. And we're looking at how the behavioral approach views personality and causes of behavior. It's important to contrast the behavioral with the non-behavioral approaches to academic assessment on these two dimensions. So this one, the conception of personality. Non-behavioral approaches consider personality a reflection of enduring underlying states or traits. In other words, personality or how someone tends to act is a result of some type of underlying trait or state within the individual. Okay. Now you can contrast that with behavioral, where personality constructs are mainly employed to summarize specific behavior patterns, if at all. In general, we really don't use personality constructs. Let's look at causes of behavior. From a non-behavioral traditional approach, the causes of behavior are intrapsychic, meaning within the mind, or within the individual. And we can contrast that with the behavioral approach, where the causes of behavior are maintaining conditions sought in the current environment. So the emphasis on the learner's learning history and the current environment in terms of assumptions about causes of behavior. And one thing that they both have in common is that there's a genetic basis to behavior. So they both have that in common. Now the problem with the non-behavioral traditional approach is if some of the causes of behavior are within the individual, and so there's no assumption about the causal role of the environment, then what this does is it restricts an assessment of why the student is not learning something or why they're engaging in challenging behavior to variables that are inaccessible or unalterable. In other words, if a student's learning of their behavior is due to some underlying state or trait or some variable, something within them, like some aspect of their mind, well, a teacher or a practitioner has no direct access to those things. They cannot, and they also cannot manipulate those things to improve the behavior. You see, the problem here is saying if you say that personality or some aspect with some variable within the individual is the cause of their behavior, then the behavior in that assessment is the dependent variable. And the internal variable is the independent variable. So the only way to change the behavior is to change their personality or some aspect of their mind or some other intrapsychic variable that's not observable or measurable and actually isn't physically accessible to the teacher or the paraprofessional or the psychologist or the behavior analyst, you name it. Okay, so a behavioral approach, by assuming the causes are in the environment, really leads the practitioner to assess relationship or relations between behavior and environment that are all accessible and alterable by the practitioner. All right, ASR number 1, intrapsychic, or within the mind or within the individual, is a characteristic of A, the behavioral approach, or B, the traditional approach. A couple more seconds. All right, I'll close the poll, and this one you should have answered pretty quickly and correctly. It's B, traditional. Now let's look at, we've looked at assumptions, let's look at implications. Okay, so non-behavioral implications and behavioral implications across these dimensions. What role the behavior plays in the assessment, the role of history in the assessment, and the consistency of behavior. Right? So non-behavioral assumes importance of behavior only so far as it indexes, or let's say is a measurement of or indicative of some underlying causes for the learning problem or the behavior. You can contrast that with the role of behavioral in a behavioral assessment, where it's important as a sample of a person's repertoire in a specific situation, so what they can do in a given context, condition, setting, situation with certain materials or certain people, certain activities, right? And so in that sense, behavior is not a symptom or an index of some underlying cause. The cause is in the environment, and the behavior is what we're assessing. And in addition to the relation between the behavior and the environment. Now, a non-behavioral approach, in terms of the role of history, they consider history, the learner's history, to be relatively unimportant, except, for example, to provide some type of retrospective baseline, perhaps for a pre-post test. And so, in other words, learning history isn't really given so much consideration as in terms of what to do next, or how to describe what's wrong with why the student isn't learning, or why they're engaging in challenging behavior, right? They don't refer to a learning history. Now, the role of history is crucial in a behavioral approach. It assumes that present conditions, that means the current state of the learner's behavior, is seen as a product of the past. So we give weight to the learning history, and that influences how we interpret the results of the assessment. And also leads to identification or selection of an appropriate intervention or practice. Now let's look at the consistency of behavior. Now, behavioral approaches actually expect behavior to be consistent across time and settings. That makes sense if you recall that approach doesn't attribute causation to the environment. So if it doesn't attribute causation to the environment, then if you change the environment, why would the behavior change? Well, we know that behavior changes across environments. The consistency of behavior from a behavioral approach is that behavior is thought to be specific to the situation, and that fits very well with everyday observations and common sense. Right? So these are some implications of taking a behavioral view versus a non-behavioral view in an assessment. ASR number 2, which type of implication of a behavioral approach to academic assessment is described by saying that the approach views present conditions, what the learner is doing, as a product of the past? Is it A, the role of behavior, B, the role of history, or C, consistency of behavior? A few more seconds. All right, I'll close the poll. The answer here is the role of history. ASR 3, behavior assumes importance only insofar as it indexes underlying causes. So let's rephrase this, because this isn't worded as well as it could be. Behavior is assumed to be important only insofar as it indexes underlying causes of the learner's problem. Is an implication of which approach to academic assessment? A, direct behavioral assessment, or B, traditional methods? A couple more seconds. All right, I'll close the poll. And the answer here is B, traditional methods. Direct behavioral assessment approach does not assume that behavior is a symptom of anything, that behavior is what is of interest, and it's assumed that the environment is the cause of the behavior, which can be discovered through rigorous assessment of functional relations between the behavior and the environment, which will then lead to an effective teaching practice or intervention. ASR 4. That behavior is consistent across settings and time is an assumption inherent to which approach to academic assessment? Give me a couple more seconds. All right, I'll close the poll, and the answer here is B, traditional methods. Assume that it's consistent across settings and time. And that's not the case for direct behavioral assessment, which assumes that behavior varies as a function of the setting or context and can also vary over time. Uses of data. So non-behavioral approaches use data to describe personality functioning and etiology and other hypothetical constructs that are indirectly measured, such as IQ. And the data are used to diagnose or classify. They're used to make a prognosis or maybe to predict a student's behavior in the future, or how a student or a client will behave under certain conditions. All right. But the behavioral approach uses data to describe target behaviors in the maintaining conditions in the environment, to select the appropriate treatment, to evaluate and revise treatment, and this is critical, to predict and control learning. Okay, by control, what we mean is through treatment evaluation, using single subject design methodology, demonstrate functional relations between the behavior or the skill that the student is learning and the intervention or the practice or some other environmental variable. It's only when we're able to demonstrate those types of functional relations do we have causal evidence, and we can conclude as a result of our assessment or evaluation that the intervention is working or it's not working, or how well it's working, or whether a change in behavior or a lack of change in behavior is due to some other variables. Okay? And that's not the case with traditional approaches. All other approaches to assessment are focused on prediction, but definitely not control over learning. ASR 5. Which type of assessment uses data to predict and control academic performance? Is it A, direct behavioral assessment, or B, traditional methods? A couple more seconds. We're going to close the poll. The answer here is A, direct behavioral assessment. ASR 6, descriptive, not prescriptive, refers to which approach to the use of data during academic assessment? A, direct behavioral assessment, or B, traditional methods? A couple more seconds. Right, to close the poll. The answer here is B, traditional methods. Now, direct behavioral assessment is prescriptive. It guides the teacher or practitioner to select an appropriate intervention from the scientific literature, or in other words, based on the best available evidence and the evidence-based practice of applied behavior analysis. Traditional methods don't do that. Okay. And finally, let's look at other characteristics. So we're gonna the other characteristics we're gonna look are the level of inferences about behavior and comparisons that they make, methods of assessment, timing, and scope of assessment. So let's look at non-behavioral. So the level of the inferences are medium to high in terms of how many, to what extent inferences are drawn about potential causes of behavior. In other words, how heavily you have to rely on inference rather than empirical evidence or experimental evidence for a given cause of a student's problem or the effects of an intervention. For comparisons, in the non-behavioral traditional approach, there's more emphasis on inter-individual, what's called nomothetic comparisons, which are comparing students to a norm reference, to a normal distribution, what's known as a norm reference assessment. So the way you can think about that is traditional approaches compare one student to other students, rather than comparing that student to their prior performance. There's more emphasis on indirect methods of assessment, such as interviews, self-report. Timing of assessments, pre and perhaps post-treatment, or strictly to diagnose. In other words, rather than taking repeated measures frequently over time of the behavior in the assessment process. Non-behavioral approaches tend to collect data in a pre-test and then a post-test after an intervention has been implemented or a practice has been used. Or they may simply use assessment just to diagnose. And then scope of assessment, they use more global measures, so kind of related to like what's the overall, is the problem cured, or overall did there seem to be an improvement, but only of the individual. Okay. And so by only on the individual, what I mean is like assessing the individual in a broad sense, not assessing like very specific behaviors or aspect of behavior. Okay, now on the behavioral side, the level of inferences are low. You really, in a behavioral approach, you try not to infer too much. You really focus on empirically demonstrating the causes of a student's problem behavior or the effects of an intervention on learning. There's more emphasis on intra-individual or ideographic comparisons, which means you take a criterion-based approach to assessment. So, okay, so two ways that a behavioral approach to academic assessment focuses. So two ways two focuses. One is to compare the individual's current performance to their prior performance, not to other students or to other individuals, but just compare their current performance to their own prior performance, or to compare their performance to a performance standard. Okay. So, for example, in this class, it doesn't. All that matters is, in terms of what your grade's going to be, is the number of points required to earn a given grade. And it doesn't matter how anyone else in the class does. It only matters what you do and how well you perform in the class in terms of what grade you'll get. Okay. That's an example of a criterion-based approach to academic assessment. Now, the intra-individual approach that I mentioned, where you compare to prior performance, well, in this class I've given this bonus assignment of using SAFMEDS, where you're to take a picture of your graph data showing your performance, your fluency as you were practicing throughout the week, and then you upload that picture and also a video, a video of your real life performance demonstrating a trial in which you go through all the flashcards and answer them. And at that point, what I would be doing is I would be observing your video, calculating the rate of correct responses per minute, and then comparing that to your prior performance. And if it's, the way we have it arranged now is if the performance in the video is equal to or greater than the performance in the graph, well then I'm going to give you, well, there's points tied to that, right? And so that's an example of intra-individual where, and in fact, I might even decide at some point to raise the bar where I require a higher rate of performance with a subsequent set of SAFMEDS cards before I give points, right? So in that case, now I'm comparing your individual performance now to your performance in the past and using that as a basis for assessing improvements in that skill. So now, methods of assessment, there's more emphasis on direct methods, so observations of behavior in the natural environment rather than using interviews or questionnaires. Okay, timing of assessment, more ongoing prior, during, and after treatment. Okay, so assessment is ongoing. It's all the time. It's continuous. And then scope of assessment. The behavioral side, you have specific measures and of more variables. So of target behaviors in various situations, you're assessing side effects, context where behavior occurs, strengths as well as deficiencies of the student's repertoire. So those are some other characteristics, characteristic ways in which behavioral and traditional approaches to academic assessment differ. Okay, let's do some ASRs. ASR 7. Pre- and post-test measures are much more heavily relied on in which approach to academic assessment? A, direct behavioral assessment, B, traditional methods. I'll give you a few more seconds. Alright, I'll close the poll, and the answer here is B, traditional methods. ASR 8, which approach to academic assessment considers the student or client's learning history, repeatedly and frequently assesses learning or behavior change, and considers more variables that are directly accessible to the instructor? A, direct behavioral assessment, or B, traditional methods? A couple more seconds. Alright, I'll close the poll. The answer is A, direct behavioral assessment. Alright. And we can talk a little bit more here about criterion-based academic assessment versus norm-referenced academic assessment. So on the criterion-based, it compares a student's performance to their prior performance, not the performance of other students. It relies on direct observation and measurement of student behavior. Results inform the development of an appropriate intervention, so the results of criterion-based academic assessment are also prescriptive. They're useful for progress monitoring because they're easy to use for repeated testing. And they're highly sensitive to immediate changes in skills resulting from interventions. That's important because for some, especially learners in special education, a lot of times the rate at which they learn is a lot slower than typically developing children or children without learning disabilities and so forth. And so it can be very difficult to detect small improvements. That is, when a student starts learning as a result of an intervention, it may start out slow, and so you want to use methods of assessment that are sensitive enough to detect that the student is actually starting to learn, and so you need to stay the course and keep that current intervention in place. So criterion-based academic assessment aspect of the behavioral approach to academic assessment is highly sensitive to those small changes. Let's contrast this all with norm reference. So norm reference compares a student's current performance to that of other students. Does not rely on direct observation and measurement of student behavior. Often used to classify students and classify what they need to learn, but does not how to teach it. It's not useful for progress monitoring because they're difficult to use for repeated testing. And it's not sensitive to immediate changes in skills resulting from intervention. ASR 9 compares a student's current performance to that of other students. A, criterion-based academic assessment, or B, norm-referenced assessment. A couple more seconds. Okay, I'll go ahead and close the poll, and the answer is B, norm-referenced assessment. ASR 10, results inform the development of the appropriate intervention. Is a characteristic of A, criterion-based, or B, norm-referenced academic assessment. A couple more seconds. Alright, I'm going to close the poll, and the answer is A, criterion-based. ASR 11, not sensitive to immediate changes in skills resulting from intervention, is a characteristic of A, criterion-based academic assessment, or B, norm-reference assessment. A couple more seconds. Alright, I'll close the poll, and the answer is B, norm-reference assessment. Alright, that wraps up this video part. I'll see you in the next video part with a conceptual review of direct observation and measurement of academic skills.